Hello, good day, ma'am. I am Michael Mercado and I'm going to present physical examination. It is a health assessment in the collection of data about an individual health, and physical examination is a head-to-toe review of each body system that offers objective information about the client and allows the healthcare provider to make clinical judgment. The purpose health assessment is to make a clinical judgment or diagnosis about the individual's health state or condition and to obtain baseline data about the client's functional abilities and physical examination for routine screening to determine the client's eligibility for health insurance and for acquiring a new job and for client's admission. The equipment BP apparatus, thermometer, pen light, drape, screen, tongue depressor, nose spectrum, otoscope, stethoscope, percussion hammer, vaginal spectrum, gloves, and gown.
Assessment: assess the client physical and psychological aspect before and during examination and review the body areas to be examined. Planning: make a physical and environmental preparation before examination and determine and prepare materials equipment needed. Explain the procedure to the client, properly position the client, take health history of the client, conduct physical examination using the 4 skill in physical assessment. Make a physical, psychological, and environmental preparation before examination. Environmental preparation is an infection control. Hand washing is done before examination. Wear PPE as needed to reduce contact with microorganisms. Examination of clients requires privacy as well as equipped examination room is preferred by adequate lighting is needed. Equipment should be clean and ready to use. Physical preparation involves ensuring the client is dressed and properly draped. If examination is limited to a certain part of the body, it is unnecessary to undress the client completely. Positioning: healthcare provider assumes proper positioning so that the body parts are accessible and clients feels comfortable. Physiological preparation: explaining the procedure to be done reduces anxiety. The healthcare provider should convey an open, receptive, and a professional approach. Gather and take the health history of the client, which is personal history, family history, history of the present illness, history of past illness. Conduct physical examination from head to toe using 4 skill assessment, inspection, palpation, percussion, and auscultation. Note the general appearance, level of consciousness, skin color, nutritional status, posture, mobility, facial expression, speech, hearing, and physical or personal hygiene. For the procedure: assessing the skin, check the skin color, uniformity of the skin color, skin lesions and skin moisture, and skin turgor. Assessing the nails, nail texture, nail plate shape, nail bed color. Assessing the head, hair, heaviness of the growth of the scalp, evenness, texture and oiliness, thickness, infection and invasion. Assessing the skull and face, skull size, shape and symmetry, skull nodules or masses and depression, and symmetry of facial movement. Assessing the eye structure and visual acuity, inspect the eyebrows for hair distribution, eyelids, ability of blinking, conjunctions, cornea, pupil of color and symmetry of size, pupil reaction to light. Assessing the ears, auricles, color symmetry, auricles elasticity, hearing acuity, client's response to normal voice tones, client response with whispered voice, non-consecutive numbers. Assessing the nose, external nose for any deviation in shape or in color and flaring discharge from the ears. Assessing the mouth canal or pharynx, lips and vocal mucosa, teeth and gums, tongue, floor of the mouth, tongue movement. Assessing the neck, Inspect the neck muscle, observe head movement, palpate and thyroid glands. Assessing the thorax and lungs. Shape symmetry of the thorax from posterior and lateral views. Palpate the posterior thorax. Palpate the posterior chest for respiratory exertion. Anterior thorax. Inspect the breathing pattern and breath sounds. Assessing the abdomen, physical, the abdominal skin integrity, inspect the abdomen for contour and symmetry, auscultate the abdomen for bowel sound, inspect the muscles for size, inspect the joints for swelling, palpate each joint for tenderness, smoothness, neurological, bicep reflex, tricep reflex, knee and ankle and plantar. Last, head-to-toe assessment record. Evaluation. Evaluate findings of health assessment and physical examination done on the patient. Documentation. Record the document and report the permanent findings found during assessment to appropriate personnel.
Give it to me like